And I was going to say that in regards to weed, weed, I'm sure during that period of time, I don't know exactly when it started becoming mainstream. I just don't remember the days or the years. But at some point in this, weed is probably, if it wasn't already, it is becoming mainstream.
Yeah.
Like alcohol is.
Yeah. It's not dope anymore. It's just,
Legal.
it's, yeah.
What's funny is
And you got a bunch of people talking about how recovery, that's one thing that, because I get onto, I search these things all the time. I always see, well, weed is what's helped me get clean. Weed
see that a lot. Yeah.
I see that a lot. I see, well, I have a drink here and there, but I don't, I can't do this drug or whatever, so people try to normalize it, and society really has let it go mainstream to where, everybody does it. I mean, grandmas do it.
Yeah.
Actors, baseball players, it's not just the couple of basketball players that do it. It's not just the couple of, you know what I mean? Like
it's definitely not a niche drug like we're talking about. Yeah.
It's a global thing now. And I think, so I kind of have, so like with alcohol, right? Like for me, like when I think of alcohol, like one glass of wine is apparently healthy by a doctor, right? One glass of wine
apparently
isn't healthy for me because I can't do that one glass.
That's the thing.
You know what I mean?
Yeah, that's the only problem. Yeah.
That's my moral of it, right?
Sure.
It's like those people can do it and it's fine to be mainstream for them. Does it make it hard for me? Yeah. But like for them, it's not deathly. For me, it's deathly. And it's knowing
that's where the allergy comes in for us.
Yeah. And it's knowing like, because I used to get resentful, honestly. Like I used to really want to drink regularly or do things regularly, and my scope now in my recovery has changed. Like before I used to think like it has to be dead set across the board like all the time. I've ran into some circumstances where I can say like a harm reduction model, so say like a facility where people can smoke or whatever.
Right.
Like there are some of those where I believe sure there's positive work going on. Do I feel like it would have been beneficial for me? No, because like I feel like it keeps me on the same wavelength, right? Like you need a period of abstinence to get your head clear, and like I've seen people that have had that period of abstinence and been able to go back to using regularly, and they've been fine. I'm just not willing to test it. Yeah. You know what I mean?
Yeah.
And so like my view of things, I've gotten it.
It doesn't work.
Yeah. I've tested it.
For me. For me, it doesn't work.
I've tested it like younger with my relapses, but I've seen people, I don't think it's statistically the normal thing, right? Mm-hmm. But my view of things now is so wide because I see all over the world. I definitely see where some people benefit from certain things and some people don't. Like people, for instance, like people that want to be on like an all holistic approach, like I really support that. But like some of those people do smoke. Like if that's beneficial for them and it's not tearing away, it's not like if there's no outside consequences, if you're not seeing consequences, then continuing to do things despite consequences, if it's not affecting interpersonal relationships and like it's like treated
if it doesn't consume you
as a medicine, you know what I mean? Like not morning, middle, night.
Just recreation.
Just like a medicine or CBD, I could see then because I don't like harming anyone that might help someone's trauma, right?
Sure.
Because
I get that.
A lot of people use it for mental health and that's completely separate from substance abuse. Substance abuse is one thing that's different because it incorporates mental health, right? Like we're normally what we call dual diagnosis, which means like we have mental health issues and we have substance health.
Exactly.
Normally they intertwine. And so there are some people that have like, and we would still consider those normies, you know what I mean? That can do that and maybe it is beneficial. But for my mental health, drinking and the mainstream stuff isn't beneficial for me because I obsess over it.